Good morning. Welcome, everyone. We'll get started in just a minute or two.
Good morning, everyone. We'll go ahead and get started. My name is Marty Ridley, and I'm part of the communications team here at Groundwork Ohio. So, on behalf of our team, I'm excited to welcome you to this webinar, The Women's Case for Childcare, Data, Stories, and Solutions. I want to start with a little bit about us. So, just an overview of Groundwork Ohio's mission and the importance of early childhood policy. Today's webinar is proudly presented by Groundwork Ohio. We are a committed, nonpartisan public policy research and advocacy organization formed in 2004. Groundwork Ohio focuses on the prenatal to age 5 period, and we champion high quality early learning and healthy development strategies that lay a strong foundation for Ohio kids, families, and communities. We engage, educate, and mobilize diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. And that is how Groundwork Ohio advances quality early childhood systems in Ohio. A few housekeeping items. We want to remind all of our viewers that today's webinar is being recorded and will be posted to our YouTube channel for viewing and sharing on demand. Closed captioning is available in your Zoom settings. All participants are muted right now, and we ask that you please use the Q&A feature for questions and include your email address with your question if you can. If we can't get to your request or question during the webinar, we will follow up after the webinar if you provide that email address for us. All participants will receive a recording of the webinar along with materials shared via email after the webinar is concluded. So let's talk about what we're getting into for the next hour. Up next, we will have the state budget update from my colleague, Brittany Bolton, Vice President of Groundwork Ohio. And then Vanessa Butler, our Senior Director of Community Relations and Special Projects, will present key findings from this brand new publication before introducing you all to our growing Women's Coalition. After that, Vanessa will moderate today's panel discussion on the realities of childcare barriers featuring our esteemed guests. We have Amy Goyle from the Women's Fund of Richland County Foundation. We have Christian Davis, founder of Cincinnati Parent Empowerment Network, and Cheryl Rose, partner over at Constellation Wealth Advisors. We will save some time at the end for Q&A, and remember that you don't have to wait until the end. So if a question pops up for you, feel free to enter your question into the Q&A tool and we'll address it during our Q&A time. And after Q&A, I will meet you right back here to close us out. Does that sound good? Okay, I am very happy to introduce you to my colleague and Groundwork Ohio Vice President, Brittany Bolton, for a timely update on the state budget. Thank you, Brittany.
Thanks so much, Marty. Good morning, everyone. I'm so excited for this panel today, and I will be brief and not too weedy so that we can get right to the heart of the discussion. But I did want to share, if we're not groundwork, if we don't share a state budget update. So just an awareness for the timeline, House Bill 96, the amended substitute version of the bill, passed off of the House floor on April 9th. So the governor shared his version, the House updated. It was largely passed along party lines. There were a few floor speeches from some of the Republicans. 5 voted against the majority party, some of them citing concerns about putting public investments into the Brown Stadium, which I am sure many of you have seen the news coverage around. That's been a hot topic. On the childcare side of things, we saw the House put back in $100 million worth of federal funding after first cutting $300 million. So we've seen them reinvest in the Child Care Choice Voucher Program, which is a limited amount of child care subsidy options for folks who are earning up to 200% of the federal poverty level, roughly $62,000 for a family of 4. However, we're really hoping in the Senate we can get that back to the governor's version. He had another 25 million invested in his version, and he had also expanded the baseline federal poverty level to 160%. It's currently the lowest in the country at 145% of federal poverty level for a family to access child care subsidy in the state. We are also going to be pushing on the Senate to restore the governor's investments in home visiting programming. The House took $22 million out from the governor's version, and that's really critical for helping moms and babies right after birth, as well as families who are kinship and adoptee families. We also know that the kindergarten readiness assessment was taken out during the House version of the bill, and we really want to see that put back in, as it's the only metric we have to see how young children are doing as they're entering kindergarten. And again, we want to see a restoration of some of the funding for infant vitality services to help more babies reach their first birthdays. About $1.5 million was cut each fiscal year in the House version of the budget that we're really hoping to see put back in so we can see more Ohio babies reach their first birthdays. A couple other little notes. The Imagination Library funding received a tiny bump, but we'd love to see a little bit more. And we will be doing an action alert later this week specific to senators. Thank you to everybody. We had almost 1,000 people reach out to the House in the final deliberation period of the bill. It was a really quick turnaround. So we'll be pivoting and sending messages to our senators here this week. So we'll get that out in our newsletter. Keep your eyes peeled. And we anticipate public testimony the week of May 26th in the Senate Finance Committee. There might be some public testimony in some other standing committees the last week of April or first 2 weeks of May, but we know for sure that week of May 26th we can testify in Finance Committee. So please keep an eye out for action alerts and ways to engage. If you'd like to testify, we're happy to help you. The legislature is on spring break right now, so if you see your members in their district, it's a great time to get them aside and tell them what you care about. And we really look forward to working with everybody on this call to make the state budget as strong as it can be for moms and young children. With that, I will pass it over to my colleague Vanessa and let her get started with our panel. Thank you.
Well, thank you so much, Brittany. And what an opportune time to actually just take a brief moment and take action now. As part of our ongoing efforts to advocate for policies that support women and families in Ohio, we invite you to join hundreds of other women and advocates across the state in signing onto a letter urging the Ohio legislature to prioritize support of the child care and child tax credit investments in Governor DeWine's executive budget proposal. We are dropping a link in the chat, or you can feel free to use the QR code on the screen. Just give a couple of seconds. Okay. So this is why we do what we do. Data shows us that the first 5 years of life are foundational because 90% of a child's brain develops before the age of 5. That means the earliest years aren't just important, they're foundational. The quality of interactions and environments have lifelong impact. Next slide, please. Public investments during these early years yield some of the highest returns on investment in education, workforce development, and health outcomes. Research shows that high quality early learning experiences between prenatal to 5, in fact, yield a 13% annual return on investment in these areas. In Ohio, this means that every dollar allocated to these early experiences not only positively impacts our youngest children, but also creates significant economic benefits for our communities. We continue at Groundwork Ohio to prioritize these investments and lay the groundwork for a more prosperous and equitable future for Ohio. When we talk about early childhood investments, we're not just talking about the first 5 years. We're talking about setting the course for a child's entire life and the economic health of our state. And yet, less than 1 in 5 babies from low-income families in Ohio have access to childcare programs. By the time kids reach kindergarten, 65% are not ready to learn, and that increases to 79% for low-income children. This doesn't just impact our youngest residents, but their parents and caregivers as well. 1 million working parents in Ohio have had to reduce their work hours because of childcare barriers. So we have to be intentional in asking ourselves, what does this mean for Ohio's future? If we do not invest now, we will have to pay later. From national to local headlines, people are ringing the alarm about the childcare crisis. These headlines highlight the truth that we already know. Childcare is foundational to our economy. When childcare is unaffordable, unreliable, or unavailable, women are disproportionately removed from the workforce, and employers across not just Ohio, but across the nation are feeling the impact. Addressing the childcare crisis isn't just a women's issue alone, but a business one, a labor issue, as well as a community issue. The National Women's Law Center's report, The Recovery Paradox, highlights significant economic challenges that women continue to face, particularly following the COVID-19 pandemic. As of June of 2024, over 40% of women reported concerns around their family's income and their ability to pay bills. The expiration of pandemic era funding has magnified the lack of sustainable investments and access to affordable childcare. And the link to this report is being dropped in the chat. A September 2024 USA Today article highlighted that the soaring costs of childcare are significantly widening the gender pay gap, particularly affecting women in their 30s. While the childcare crisis impacts all parents, moms are disproportionately bearing the financial burden. This often forces them to reduce their work hours or exit the workforce altogether, leading to long-term income disparities. We are dropping this link also in the chat, and you can also find the article by using the QR code on the screen. So all of this information and data led us to ask the question, how do we create economic prosperity for women in Ohio? We published an issue brief, The Women's Case for Childcare, which I'll walk through over the next few minutes. We are also dropping a link to the issue brief in the chat. So the answer is simply, Ohio must invest to provide affordable, accessible childcare options. Next slide, please. The clearest indicator of economic instability in Ohio is how disproportionately poverty impacts women, especially female-headed households, when they are more than 3 times as likely to live in poverty compared to the general population. When children are in the homes, the burden grows even heavier. This is a daily reminder and reality for many women across our state who are working and making critical decisions pertaining to their households every single day. And this begs the question of how intentional we are about addressing generational poverty for women. This data derives from a statewide survey conducted by Public Opinion Strategies in December 2024, where 800 registered voters and an oversample of 484 working parents with children ages 5 and younger were surveyed. One staggering data point showed us that more than 6 in 10 Ohio moms with children 5 or younger who do not currently work full time say they would go back to work if they had access to high quality and affordable childcare. This demonstrates that moms are scaling back their work hours because childcare is either too expensive, too unreliable, or simply unavailable in their area. This is a missed opportunity, not just for individual families, but for Ohio's workforce and economy as a whole. In Ohio, the average cost of care for just one infant is over $12,000 per year, costing more than $1,000 per month. With median earnings for women in the workforce full-time being $44,230, this means that more than a quarter of her income could go just to childcare for one child. This doesn't include basic essentials like food, housing, transportation, or other essential needs. The math just isn't adding up, and the level of financial strain forces too many parents, particularly moms, to leave the workforce or pass up opportunities for career advancement. Unfortunately, Ohio currently ranks last in the nation when it comes to eligibility for publicly funded childcare for children ages 0 to 5. Right now, only families earning 145% of the federal poverty level or less qualify for assistance. In 2024, that was $37,399 for a family of 3. This threshold excludes so many working families who are struggling but don't meet this rather narrow definition of poverty, because this makes this makes it too much to get help. They're making too much, my apologies, to get help, but not enough to actually afford care on their own. And again, this forces women to make challenging decisions for their households. In Ohio, 39% of its residents live in a childcare desert, meaning there are either no providers or far too few to meet the need for childcare. This is a daily hardship for families who want to work but do not have options to turn to for care. We know that when the state invests in childcare, everyone benefits, families, businesses, and the economy. Increased public investments doesn't just support children's development, it allows parents, and especially moms, to fully participate in the workforce. Childcare issues result in an estimated $5.48 billion in annual loss for Ohio's economy. This is a missed opportunity for untapped potential. And so all of this information culminated into the creation of Groundwork Ohio's Women's Coalition. It has been a lift since October, and we are convening this space, building community in order to empower women, because we know that quality childcare enables mothers to further their education, pursue careers, and achieve a sense of financial independence. We're also supporting child development, because early childhood is a critical period for cognitive, social, and emotional development. And we are also strengthening communities. When women and children flourish, so do our communities. The employment rates increase, there's increased productivity, and stronger family units. So join us. Join quarterly calls with Groundwork Ohio's Women's Coalition. This is an opportunity to collaborate with women serving organizations and initiatives from around the state to identify shared priorities, exchange valuable insights and experiences to address childcare needs, be a part of the policy agenda conversation with a combined voice, as well as increase visibility of the childcare crisis impact on women. We are excited. on May 8th, we are hosting our first kickoff breakfast, which will be our first in-person event where we are convening thought leaders, policymakers, and advocates to discuss how we can elevate policy solutions and continue raising awareness with a unified voice. Women leaders, like those you see on the screen, when unified and united, can have a strong voice in advocating for systemic change. We are excited to hear from these dynamic leaders and to glean wisdom. There's a link in the chat to register for this upcoming event. And now, what I have been looking forward to as a part of this webinar is our engaging panel discussion. And I am joined by three dynamic leaders across the state, Christian Davis, Amy Goyle, and Cheryl Rose. Christian Davis is a dedicated advocate for educational equity and civic engagement, currently serving as Director of Educational and Civic Engagement at the YMCA of Greater Cincinnati. As the founder of the Cincinnati Parent Empowerment Network, she has mobilized over 26,000 parents to champion culturally responsive policies and family-centered advocacy. With a strong background in education and leadership and community organizing, Christian is committed to amplifying the voices of marginalized families across Ohio. Amy Goyle is currently the vice chair of the Women's Fund of the Richland County Foundation. The Women's Fund encourages philanthropy to empower women and girls in the local community. Amy also serves as a board of advisors for the Ohio State University at Mansfield. Prior to relocating back to Richland County with her family, Amy served as assistant vice president for state relations and operations in the Office of Government Affairs at the Ohio State University in Columbus. And last but not least, our beloved board member, Cheryl Rose. Cheryl Rose is a partner at Constellation Wealth Advisors, where she advises business owners and families of significant wealth. With more than 20 years of leadership experience and wealth management at Fifth Third and PNC Banks, Cheryl also is a passionate advocate for early childhood education. She played a key role in launching the Cincinnati Preschool Promise and served as an inaugural trustee and treasurer following her service on the board by Success by Six. Thank you so much, you all, for joining this timely conversation. And so let's just go ahead and jump into it. Cheryl, I'm going to start with you. If you wouldn't mind, please share your personal success story as a woman who overcame systemic barriers to thrive in both your career and family life.
Sure, happy to talk about it. And thank you for having me here today, Vanessa. I really appreciate it. And thanks for all the work, important work you're doing at Groundwork. So I think it'll just, take a few minutes to tell you a little bit about my background and my journey and why I am so passionate about the importance of supporting quality early childhood education. So I ended up having a child on my own when I was 21. I dropped out of college and, I just was struggling to find my place in life. I was waiting tables. And really desperate to find a career path for myself. And, at the time, I was working and totally self-sufficient and just trying to make a go of it. But I was living at poverty level. It was tough to make ends meet. And the only childcare option that was affordable to me was a home care provider who was not quality home care. And I remember my son coming home at one day and he's saying curse words. And I think that was a big flag to me. And then one of my friends said, "Hey, did you know that the state of Ohio just passed legislation that is offering vouchers based on your income level?" And that was my ticket. So that was a really important moment for me because I ended up realizing the other gap for me was having access to medical insurance. And so I went to apply for a bank teller job in Dayton, Ohio, and I got on the elevator and a couple of guys asked if I was looking for a job. And I said, "Yeah, I'm going to apply for a teller job." And they said, "Don't do that. Come talk to us first." And it turned out they worked for an investment firm called the Ohio Company. They were desperately looking for a receptionist for their front desk. And it actually paid a little less than I was making as a waitress, but they said, "It has medical insurance and you can get your broker's license." And I said, yes. They hired me within an hour. So it was
Wow.
just this moment in time, that coupled with these vouchers that allowed me to get my son into a quality setting, which was so transformational for us. Launched my career. I had my broker's license within 6 months. So,
Wow.
I never looked back. I finished college. I, passed every exam you can ever imagine. But, I've really had a really wonderful career and upward mobility because of that legislation. So it's really important work that you're doing.
Cheryl, thank you so much for your transparency. And I'm sure that so many people can resonate with your lived experience. So thank you. Christian, I want to pivot to you from your work in the field and maybe from your own personal experience. What are the most common challenges parents, particularly moms, face when it comes to accessing childcare?
First and foremost, thanks for having me today. But I think there's 5 key challenges that I've seen in the field, many of whom you've already touched on. But affordability, the cost of childcare can be prohibitive, often consuming a huge portion of household income. Many families struggle to find affordable options that meet their needs. Availability, there's often a shortage of licensed childcare spaces, especially in low income and rural areas. Parents find themselves on wait lists or facing challenges in securing spots that align with their work schedules. And the quality of available childcare varies greatly. Parents want the assurance that their children are safe and receiving appropriate developmental support, which can often be very difficult to access. And then flexibility. With varying work hours and demands, many families are working non-traditional hours, and they need those childcare centers to be able to support that. However, many facilities operate within standard business hours, leaving parents with limited choices. And then
Right.
lastly, transportation. Many of the families that I assist are currently relying on the public transportation system. So accessing quality and affordable childcare is a significant barrier, especially if those facilities are not located conveniently.
Thank you so much for that insight, Christian. Um, Amy, from a funder's perspective, why is investing in childcare and economic mobility for women such a critical issue? And I also want to take this moment to plug, you just recently had a letter to the editor published this past week. And so if we can drop the link to your work and just really amplifying your voice in this space, what would you say in this moment?
Sure. Well, thank you for that, Vanessa. That was really kind. And to echo everyone else, thank you for your work and for having me today. So I think the short answer to the why is everything you've already laid out in that wonderful data, right? In the case that you're building today, which is we know that when women and children and families are healthy, our communities thrive, right?
Right.
And so here in Richland County, the Women's Fund at our county foundation has been dedicated for years, since 1996, to making investments in our community to empower women and girls. In 2018, that group of women looked at their agenda and said, okay, how can we be more strategic and intentional in investing our dollars in areas that we know will create economic mobility and upward mobility for women and girls? And through that work, they identified childcare. And we know all of the reasons you've talked about, the impacts of poverty, how they disproportionately impact women, how women disproportionately take a hit in their careers if they don't have access to childcare, and what that does to their earning potential over time. And also the workforce behind the workforce, as we say, right? The childcare
Yes,
providers in our
that's right.
community are disproportionately women, and they're facing their own economic challenges working full time, doing this important work, right? That we know is developing brains during the most critical period of child development. So for all of those reasons, it was very logical for the Women's Fund in our community to focus our investments in this area.
Well, thank you so much for all that you and your community continue to do and hopefully can model and spark some change across other parts in the state. Christian, we are knee deep in the policy process. This is a budget year. We have been hitting the pavement at the State House and around the square on why these critical investments are so important. when you are having conversations with policymakers, what misconceptions do they have about the realities that working moms particularly face?
Yeah, so I think that there are three main misconceptions. One being that mothers don't work full time. There's a stereotype that mothers prefer part-time work or stay-at-home work arrangements, ignoring the fact that many are juggling full-time jobs with caregiving responsibilities. The second being that childcare is a personal issue. Some policymakers view childcare solely as a personal or family issue rather than a societal and economic concern, failing to recognize the impact on workforce participation and economic stability that having quality and affordable childcare actually brings. And then lastly, there's a misconception that all mothers have access to support systems, which is far from the truth. Many mothers, especially mothers who are in low income situations, don't have access to family or friends or resources that can help them with childcare. So those are the three most misconceptions that I believe.
And thank you so much for lifting those, and hopefully as advocacy days continue to commence throughout this budget process, that people really take to heart those nuggets and can help amplify those reasons for why these critical investments are so important. I want to pivot a little bit to talk about women in leadership roles, pursuing careers. So let's just say in a beautiful world, women are both have the ability to be supported in the workspace and feel safe and secure knowing that their child is holistically cared for in these high quality early learning experiences. Cheryl, how do you see access to childcare impacting women's career trajectories, particularly in C-suite and other leadership roles?
Yeah, and I think, Christian, you did such an eloquent job of outlining all the challenges that women face, and
That's right.
it is a huge challenge, not just in accessing that quality care, but then you turn around and you go into the workforce, and the perceptions that exist and the systems that exist that are flying in the face of being able to be flexible. And I remembered very distinctly, and I was probably mid-career in my son was maybe 7 or 8 years old at the time. And I remember a boss saying to me, and I was definitely on an upward trajectory on a career path. And he said to me, "Well, you can't serve two masters and do it both well." Like basically, he was telling me you cannot be a mom
Mm,
and you can't be a successful businesswoman. And I'm like, I don't accept that. I mean, I don't accept that. But I had to accept that those challenges and barriers are there in the workplace, and just rising above it. I cherish my tenacity and my determination to make things happen, because there are a lot of forces against us, and then you throw on top of it the challenges that when you have a sick child and you've got to like miss an important business meeting, those challenges are real, and so we have to bond together. I think really it does take a village. It takes a community. We have to be here supporting each other, and it heightens the need for us to make sure that we are vocal about those challenges and finding solutions.
thank you, Cheryl. Um, Amy, we know the numbers and the data around the ROI, and we typically sometimes that is the end in terms of the conversations with our policymakers because they need to make sense of the numbers and how to conceptualize that long term. How do you, in addition to that ROI messaging, how do you measure the impact of investments in childcare and family support systems?
Yeah, so thank you. That's a good question. So I think a little bit, so if you can't, what's the saying, right? If you can't measure it, then I don't know. I'm going to whip the saying, but we're really working to develop ways to meaningfully measure the investments. And I think one of the challenges is that the return on those investments take time, right? And
Yes.
we increasingly live in communities and in an era where you want to see quick return on those investments. And some of that is fair, right? When you're talking about public dollars, you want to make sure that they're going to the right areas, that they're making an impact, right? And I think that meeting the reality that these investments take time is where some of the rub can be, right? So you have to then just continue to create and be an echo chamber around the importance of these investments, and then really, to the extent possible, localize the anecdotes and the individual stories and the impacts of those investments to help those policymakers and help those decision makers continue to see it, even if the data writ large is going to take time.
No, I think that's spot on. And for so many advocates that are on the line, advocacy is a marathon. It is not a sprint. So this is a perfect moment to just remind us as we continue, not just within this budget process, but also in our day-to-day advocacy dreams and goals as we work on behalf of families and children. Christian, in your parent organizing space, how can parents and the overall community become more engaged in advocating for childcare and economic policies that support families and particularly moms?
That's a great question. So I kind of broke this down into like 5 key areas.
Okay.
So the first one being community networking, like establishing local support groups or networks where parents can share resources, experiences, and strategies that can empower them to advocate collectively. The second one being education and awareness, hosting informational workshops about childcare resources, rights, and advocacy can help parents understand the policies affecting them and inspire action. And then third would be collaboration with local organizations. So there is power in numbers, and partnering with nonprofits and community centers and schools can really help create spaces where the voices of parents are amplified and elevated to a level that drives policy change, but then also serves as a connection point for local and state policymakers. And then I also said utilizing social media and online platforms. That's how I built Cincinnati Parent Empowerment Network, just off of Facebook. But there's power in social media that creates and gives parents the tools to be able to share their stories, to be able to connect with others, bond with each other, raise awareness, and call for policy changes from the comforts of their own home. And then lastly, the involvement in local governance. So encouraging parents to participate in town halls and school boards and PTAs, PTOs, local government meetings. All of those can give them a platform to express their needs and influence policy decisions directly.
Thank you so much. That was so rich and so full, Christian. Cheryl, as someone who spends time in both the private and nonprofit spaces, what would you say to other leaders, especially those in the finance and corporate spaces, about why investing in early childhood is not just a humane thing to do, but it's a smart economic strategy?
Yeah, I mean, here's the reality of it. The one thing that will drive economic growth and prosperity in anywhere is population growth of workers. So, if you back up from it and you think, yeah, it's kind, right? It's kind and compassionate and all that stuff. So true. Moral imperative, no doubt about it. But it is an economic imperative too. And I think that message gets lost. And there are plenty of business leaders and incredible data that indicates the ability not just to create space for childcare so women can get back to work. So, that's a big lift in and of itself. But now we're raising a generation and generations of young people who are prepared to enter the workforce. They're prepared to go to school and learn. They're prepared to read. They're prepared to have success in life. And what happens when you get that, in, let's say, 18 years from now, there are more companies that come in, there's more prosperity, and it is a spillover effect that is as multitudes of what most people would normally think about. But we have to invest in education on the front end. You solve the childcare issue, you get women to work now, but you're really planning for the future, and that's where the big economic benefits translate. And rising tide lifts all boats. We're all better off for it if we do this.
That's so good. Thank you. I'm going to, as I want to make sure that we have enough time for Q&A, but I want each of you to answer this final question for the panel portion. When you envision a future where all women, regardless of background, have true economic mobility and freedom, what do you see and what gives you the hope that we'll actually get there? Amy, let's start with you, and then we'll go to Christian and then to Cheryl.
Sure. So what I see is a solid foundation in our communities, in our state, in the fabrics of our society, where women have the autonomy to make decisions that are best for themselves and best for their families and best for their children, particularly in this critical period of child development, right? And one of those foundations should be a public good, like access to high quality childcare, right? So that's what I envision. What gives me hope is groups like the Women's Coalition, right? Conversations like this, creating synergy among organizations to be that echo chamber. These things take time. As you said, these changes are a marathon. They can be tiring, they can feel discouraging, but I think staying in community and being a part of groups like this certainly gives me hope.
Thank you, Amy. Christian.
I think for me, I would say I would love to see, and we're starting to see this, but just at a more amplified level, I would love to see a robust amount of mothers who are collectively coming together off of shared experiences, who are able to share their stories, really advocate and champion each other when it comes to pushing policymakers to invest in quality childcare. I think moms, we change the world. We're so powerful. We're powerful as individuals. We're more powerful together. And our children really look to us to be able to provide guidance. So I think what gives me hope is the fact that, we have these conversations. We have partners in the community spaces that are really in businesses and employers that are really looking for ways of how they can support moms, especially working moms. And so that's what gives me hope.
Thanks, Christian. Cheryl.
So listen, there is nothing more clear than the economic impact of investing in early childhood education and the payoff of that. So I think if you really want to think about this, the thing that gives me hope is it makes such great sense to invest in early childhood education. And I think that, coupled with what Amy and Christian have beautifully outlined, it gives me hope that we will get there, because it makes sense. China's investing in education at too. I mean, we got to get on the stick here. We got to have a strong workforce.
Yeah. Well, you all heard it here first. I want to just thank you again, Amy, Christian, and Cheryl, for one, always saying yes to the call, but also just truly being supportive and being strong advocates and voices in this space, particularly for women like me and other women across the state. So just thank you for all that you selflessly continue to do each and every day. Let's go ahead and pivot into the Q&A portion, and I am monitoring as my team dutifully asked me to do. It looks like all of the questions in the Q&A section have been answered, but if anyone, any of our attendees has any questions, please feel free to unmute yourselves and ask.
It looks like someone named Isa has raised their hand.
Awesome. Hi, Isa. Isa is one of our ECDI friends. Welcome.
Yeah, hi, great. Thanks for inviting me to this. This was wonderful, a lot of great information. So I'm with the ECDI Women's Business Center of Greater Cincinnati. And my question, I work with a lot of businesses who have services that are related to child care and early childhood development, but aren't necessarily considered in those buckets. So for instance, I have a client who she connects clients to services for family members who may have developmental disabilities. So she helps them navigate those complicated processes within the government if they may not meet the requirements for like Medicaid, Medicare, and they have to pay out of pocket for these services. So how do we kind of engage those type of clients in this, you know, for lack of a better term, this fight that we're a part of right now, who may have services that aren't as directly associated with that early childhood development, but is actually kind of pivotal to that process as well for a lesser, focused on part of that population.
Isa, thank you so much for this question. I'm thinking Christian and Amy might have insights on these. Amy, we can start with you and then pivot to Christian.
Sure, thank you. So I think that's a great question. I think that is the right kind of question. And if you're coming from my perspective, right, if you localize these solutions in local communities, it makes it easier to start there. So I would have two suggestions. One, generally those types of services that you described, right, in the childcare space exist through the local regionalized YWCA research and referral offices. And so those tiny infrastructures do exist in some local communities. And so maybe connecting those in the childcare space with some broader infrastructures, so whether that be the regional chambers or there's regional economic development entities that you're talking about that have a broader reach, helping to educate those folks on those resources in the childcare space for families, you may be able to amplify your reach there. I would also defer to Christian because I think she probably is much better versed in this space than I am.
Yeah, one of the suggestions I would have is to reach out to providers, especially in-home providers directly. Many of those providers always welcome in bringing in resources and information to assist their families. There are a ton of resources available that many families just don't know how to tap into. And so if you work with a provider or a childcare center directly to be able to say, hey, can you pass these flyers out to your families? Or can we maybe cater, lunch or bring some type of gift for your families so that we can connect with them directly so that we can share out what resources are available. That might be a great starting point.
Okay, thank you. Those some wonderful suggestions. Thank you.
I'll pop in. I think we might have a connection issue going on at the groundwork office, so I'll stay off video in case too many of us are on our computers at once. I think Jennifer Foster has raised her hand. If you wanted to come off mute, Jennifer. And Jennifer, I'm not hearing you yet, so if you wanted to type it into the Q&A, we'd be happy to read it out for you. Okay. We'll wait, Jennifer. The floor is yours when you're ready for it. I've got another, let's see. We did have another question in the chat during the conversation that I think might be a good one for us to revisit around what businesses can do. If there are a couple of examples that you'd like to share of what you've seen businesses do. I know we touched on this a bit, but maybe something a little bit more specific about how they can support their employees with childcare supports. Yeah, Amy.
Sure, Brittany. So I'll jump in there with just a local example here in the North Central Ohio community. This was not in Richland County. These were our neighbors to the north in Ashland County, but they had a very innovative partnership that was leveraged by their Women's Fund and their county foundation with local businesses where they raised money and built a new brick and mortar childcare facility at their industrial park in the community. And so it was an idea that a lot of community partners had, but the businesses themselves, I think, leveraged dollars, and then they also had state dollars and other partnerships in place where they developed a new brick and mortar because that's where they realized they had a gap in care, and that was what their community rallied around to fix. And so that's an example where I think businesses can just be a part of community conversations in this space, even if there's not a clear ask for them initially. If they continue to be a part of the fabric of these community conversations, I think over time, mutual solutions will appear and businesses can find a role for themselves. So I would encourage businesses to start there if they're not already connected through their local chambers. They could start there or through their local YWCA offices or community foundations or other civic entities or civic organizations that are having conversations in this space.
Thank you, Amy. That example is such a great one, and one that I know I tout around the state as well as I'm meeting with other economic drivers. I think we figured out how to allow Jennifer Foster to chat, so I'm going to hit a button. Jennifer, are you able to
Oh,
talk now? Yes, we hear
yeah,
you.
yes. Hello, everyone. Good morning,
Apologies.
everyone. You might hear my dog in the background. So, I am a community advocate. I'm a grandmother. I sit on a lot of boards. So, my question is, it's a lot of 30-something-year-old mothers that's bouncing from being on public assistance to career and education. They get hindered so much, and there's not a lot of resources for them to help navigate them towards the right place. Saying that, it's a little discouraging. Hold on a minute, my dog is barking. Okay, so saying that is me being a village mother in a community and making sure that a lot of those moms have the resources they need, because sometimes it's very discouraging to them to get the resources. And it might be effect of saying, okay, let me go back to getting, public assistance because this is just too hard. But me being a village mother, I have to support them and tell them, no, keep going, keep going. This is just a hurdle, but keep on with your destiny. How can we support more mothers that's receiving at one time services from the county and now working towards their career? It's a lot of them out there. They want to be in a career, they want to further their education. But if only a few of us had the resources to say, okay, you could connect to this in the county for it's based off your income. You could apply for these vouchers. But yet it's still me as a village mother. Now it's the process that takes time. So what do? I try to fit in and say, okay, I will watch your children for 2 or 3 weeks until that process is done and you're all clear.
And I know Christian's gonna have some good stuff on this too, but Jennifer, I just want to give you a big hug. I mean, exactly who you are and how you're showing up is exactly, I think, what we all need to do. It's certainly what helped me, give me confidence and tenacity and courage, and somebody had my back. And I think that's just magical, is be there for one another.
Thank you, beautiful.
Yeah, and I was going to say, Ms. Jennifer, what you touched on really kind of highlights what we use the term of benefits cliff. Like, if you're currently on public assistance and you receive public assistance and, now your goal or, you got increased income. And so now you're no longer eligible for some of like TANF benefits or food assistance. You're working, but, once you get off the system, then you realize that now that your cost of your rent might have gone up. If you were in income-based housing, the cost of food has gone up because now you have to pay out of pocket. The cost of childcare has gone up. And like you said, many families, many mothers especially, are kind of faced with a hard decision of, do I go back on the system where I'm restricted with opportunities? Or do I, open up a door that leads to the unknown, but is very hard at first? So what Cheryl says is that we definitely need more people in the community like you who understand that, for that first 30 days, it can be extremely tough when you're waiting for everything to fall into place. But I think most importantly too is just staying abreast of what available resources there are that are open to anyone, regardless of zip code, is extremely helpful. But then building a network, really making sure that families and moms build a network to support each other. So I always say in my network consists of everyone but my biological family. Like I have networks from college friends, I have network from church friends, from, you know, my coworkers, and those are the ones that I have to reach out to at, you know, late at night and really ask for help. So making sure that our moms feel comfortable asking for help is key. Making sure that they have safe spaces to be able to voice their concerns is going to be key. But then thirdly, just making sure that they have a supportive network that knows how to get in touch with you, like United Way 211 or other organizations that can provide some temporary assistance is going to be key as well.
Thank you so much, Christian and Cheryl, for the insight on that question. Thank you, Jennifer, for always bringing forth intentional and just thoughtful questions. We really appreciate you. We have time for one more question. This comes from Natalie Andrews. I serve as both the licensing specialist and PFCC eligibility worker for my county. Given the volume of childcare applications I receive, it is evident that there are not enough available placements to meet the demand. I have made several efforts to conduct outreach and encourage new providers, but with limited success. Has anyone implemented a successful strategy to recruit or increase the number of licensed childcare providers in their area? Amy and Cheryl, you might both have
Yeah, I'll
have
jump in
insights.
on that quickly. The short answer is we have not done this well yet in Richland County, but it is a very, very timely question because the Women's Fund here has identified this area of childcare provider recruitment and retention as a gap in our local community, right? Where everyone sort of understands it, no one's really focused on it, right? And so part of what we're trying to do is look at that gap like you would approach any other workforce gap in your community, right? So we are elevating questions like, do we have enough post-secondary providers in our community to meet their credentialing needs, right? And sometimes the ever-changing credentialing needs. Do we have enough connectivity between those programs and providers, right? And so we haven't really solved that issue yet, but it is a very real one and it's very timely. And so I would encourage you in the space of childcare recruitment and retention to connect to some of those larger civic organizations. So your local chamber, your local community foundation, and others to talk about ways that you can just in the short term more immediately meet those needs of childcare providers, whether that be subsidizing mental health services, like we're looking at that as a women's fund, right? Where are the gaps, and start small because those seem to be a little easier to tackle. And then just by elevating the conversation like you're doing now through this question, just by elevating this conversation in your community, you can certainly get other people to look at it.
Yeah, Amy's correct. And you know, through our work with the Cincinnati Preschool Promise, supply was a huge, and still remains a huge issue for us. But you know, the reality is it's also a business opportunity. So these are small business owners. And so using resources through the chamber, as Amy mentioned, you know, we partner with Minority Business Accelerator, helping women see the opportunity to set up a business and help create the infrastructure around them to give them an opportunity as well. So I think that we've got a lot of wood to chop there for sure.
And I don't have any examples of solutions, but I do know, and as we all know, the three main reasons as to why this continues to be an issue is one, because of low pay. You know, many childcare workers are just receiving pay that is not helping them maintain you know, their living standards. And I mean, it's just not at a livable wage. And then two, as a result of it not being a livable wage, many of the childcare workers are also on public assistance because they can't afford food, they can't afford housing, or, you know, they struggle with public transportation. But then also, you know, just career opportunities and growth. There isn't a lot of career opportunities and growth in this space. So I see this every day. Like I said, I work for the YMCA as well. And so the YMCA, as big as an organization we are, every association across the US faces a shortage when it comes to childcare workers, mostly around the pay and the credentialing that it takes to get there. You know, your center is the quality of your center really is a determinant of the quality of the staff that you have to fill those needs. And if you don't have quality staff, and one way that you can get quality staff is investing in your staff, and you're going to invest in your staff through pay. If you're unable to do that, then you're always going to find yourself in a cycle. But then also, those childcare workers also have children themselves, and they can't afford childcare. So it's like you're working in a center, and there are some centers that offer childcare providers free childcare, which I think is going to be is trying to be a policy push as we speak. But it's, you know, not, it's done in Kentucky, it's not done in Ohio. But that's a challenge within itself, that if you don't have livable wages, you can't afford childcare, but you're working in a childcare center, then what does that look like?
Well, thank you all again. I know that there's a few more questions that are trickling in the chat. Our team is going to work to get those answered to you, via email or to touch base personally. But truly, thank you, Cheryl, Amy, and Christian, for just continuing to lead in this space and offering your true wealth of insight today. I really do appreciate you. I'm now going to transition to Marty with a few organizational updates.
Unmute sometimes. All right, so before we wrap up today, I want to share a couple of opportunities for you to join our work in advocating for policies that make Ohio the best place to be a young child. So the first that I want to share is Groundwork Ohio's Family Action Network. The network is all about empowering parents and caregivers to use their voices to lead change. So if you are a parent or a caregiver of at least one child under the age of 6, this is your chance to be a part of a powerful movement that's changing systems and influencing policies that directly impact families. We truly honor your time, your story, and your leadership. And this isn't just about being heard, it's about having influence. If you are interested or have someone in mind or a family in mind that would be great for this opportunity, you can learn more or share at groundworkohio.org/family action. And we are sharing a link in the chat. Another opportunity that I appreciate, I also would like to personally invite you to join the morning meeting. So this is Groundwork Ohio's weekly online gathering for champions of young children in Ohio. You can plan to join us on Thursdays from 9:30 to 10. So it's just a short little break. Grab your coffee, grab your muffin, grab your healthy snack, and you can connect with Ohio policymakers, business leaders, early childhood professionals, and advocates from all across the state that tune in. When you join the morning meeting, you will get real-time updates on early childhood policies. You'll build powerful connections with other advocates, and you will help strengthen Ohio's early childhood movement. So I would personally love to see you at the next morning meeting. It is our shared space to grow Ohio's commitment to young children. All right, so we thank you all again for joining us this morning. Continued gratitude to our panelists, Cheryl Rose, Christian Davis, and Amy Goyle. Please stay connected with us through social media, and we will see you next time.